Hi, I'm Dr. Greg Grillo with Express Dentist, and I'm here to talk a little bit about dental pricing. Dental expenses can add up. They can be a challenge to fit into a budget, especially if you're one of those folks that doesn't have dental benefits. Dental benefits certainly help with the cost. They don't cover all of it. It's more of a co-insurance, helps with cost sharing, but it does make a difference. So if you're going to the dentist, it's nice to have a little bit of an idea of what to expect, even though you don't know what the problems may be or what your treatment needs may be. At least if you have an idea, it can certainly help you plan. And, there are some significant variations in dental costs even around the country. So depending which region you're in, whether you're urban or rural, the type of practice, the volume of the practice, there's just a lot of different things that fit into it. And so really the only way to get an accurate idea is to ask for a quote for your services. And it's perfectly okay to ask when you're coming in for your first visit, what will my first visit cost? Just so I know, even for diagnostics or for a cleaning. And then, of course, before you start treatment, be sure to have at least an estimate, even if you have insurance, as to what costs to expect, because they can vary widely and there can be a significant difference between, say, the cost of a filling and the cost of a crown or root canal. Sometimes these costs could be 10 times apart. And so it's always wise to have an estimate and a good financial plan when you get started. As a general rule, the cost of routine dental care is one of the best investments you can make because preventive care is usually the least expensive care and it keeps you from getting into bigger problems. So you may, you're going in for a dental exam. Maybe you're going to spend $100 to $150 on a dental exam. Maybe you're going to have a cleaning, depending on the type of cleaning. Again, where you're at, it could be $75, it could be $200. If you have gum disease and much more extensive needs that are going to require more therapy, then you could be spending, $200 or $300 per area of your mouth. The mouth is divided up into 4 different areas, and you could be, spending, making an investment in each area of the mouth to get it back to health. And then, of course, there's things like dental sealants and so forth that are also a preventive measure, especially for kids in most cases. And those can be very helpful and very cost effective. Sometimes they're, only $30, $40, $50 per tooth. Now, when you get into restorative needs, that's when a tooth is damaged. So if you have a cavity or you have something that's broken, then, you could spend $75 to $250 on a filling. And it depends on the size of the filling and the surfaces of the filling that are involved. Chips could be similar. But if you have chips on front teeth or large breaks, could be anywhere from $100 to $500. Now, if a cavity reaches deep into the tooth, and you've had an abscess or infection and you want to save that tooth, then a root canal could be $500 to $1,500, again, depending on the tooth. What's important to know is that once a root canal is done, if it's a back tooth, it may need to have a crown on top of it as well. That can be another $1,000 to $1,500. So you can see that you could fairly quickly make a significant investment in saving a tooth that's had an infection. I think the important thing to understand is that why is preventive dentistry the best dentistry? Because you spend a little bit to identify those problems early, and maybe it's $150 filling. If the cavity progresses and it needs a root canal and a crown, you may have a $2,500 to $3,000 tooth very quickly. So those costs can certainly escalate. If you're missing teeth and you need dentures, there's various options there. You may be able to get away with something that's as little as $500 in some situations, but you can also spend several $1,000s depending on whether you need one arch or both arches, upper and lower. If you're going to add dental implants, that type of thing. So, implants can be $1,000 to $5,000 each. It depends if you're replacing a single tooth, if you need a crown, or if it's going to be used to support dentures. There's multiple options in that way. And, if you decide that you need to have a tooth removed, removing a tooth is fairly economical. Of course, you may have the cost of the exam and the x-ray, but it could be anywhere from $75 to $200 to have the tooth removed, in some cases more, depending on the complexity. There's a number of surgical type procedures that can be done. If you have gum disease and you're in danger of losing your teeth, or receding gums, you may need to have a surgical procedure done if you want to save your teeth, and that can run several $1,000s, sometimes $4,000 to $10,000, depending on how serious the situation is. There are cases where people have complete breakdown of their teeth, but they still have a good foundation underneath the gums, because 2/3 of your teeth is underneath the gum line. But if that top 1/3 is worn out, then to restore and rebuild that, it can be a very significant project. There are times where you may spend $30,000 or more to restore all of the teeth back to full health. When you get into orthodontics, that's kind of a rite of passage for a lot of young people, but it's also something that a lot of adults look at these days. And so metal braces can be anywhere from $3,000 to $7,000, just depends. Ceramic braces can be similar, sometimes a little bit more. And, Invisalign or clear braces is something that a lot of people are interested in, especially adults. And those can run anywhere from $3,500 to $7,000, just depends on the complexity and, again, the region of the country. And, there's a lot of different types of appliances, retainers that can be made depending on what the needs are. But retainers can help hold teeth in place so that they don't move, and they could be $200 to $500. I mean, there's certainly some different options there. There's some nice elective procedures that people are looking at, such as veneers. So veneers are, put a nice covering over the teeth, like a contact lens in a sense, very beautiful, kind of the Hollywood smile. They can be $1,000 to $2,500 per tooth. So depends. If you need one, maybe that's fits your budget, but if you need 8 to 10 of them to fix your smile, that can obviously be a very significant investment. And then sometimes Botox is used now in dentistry. It can be used for aesthetic reasons, cosmetic reasons, or it can be used to help with TMJ or teeth grinding issues. And those treatments can be anywhere from $300 to $1,000. It just depends. So, this isn't meant to be a comprehensive review of all pricing. I think the important thing is to know that there are really significant variations in dental costs, and it really depends how extensive your needs are. But if you can find a way to invest in preventive dentistry and have regular checkups like every 6 months or even once a year, and identify problems when they're small, that's a really good investment. It's a good investment, obviously, financially, because it can save you a lot of money down the road, but it can also save you a lot of grief and really help your confidence and your quality of life. And that's very important as well. So, the best thing to do is if you're unsure about your needs, don't rely on pain, because that's a poor late indicator of advanced dental problems in many cases. So, go in, see a dentist, get an evaluation, make that small investment, and then make a decision based on clear costs and your goals and some of the options that are available for financing, to see if it's worth making that investment, in your dental health. It almost always is. The mouth is the gateway to the body, and it's a really, really important area to take care of for overall health. So if you need any help finding a dentist, Express Dentist has a network of trusted professionals that we can help you get connected. So please feel free to reach out. We're here to help. And, at the end of the day, take care of your mouth. It'll take care of you. And all the best in the year ahead.